A nurse is preparing to care for a patient on airborne precautions who has tuberculosis (TB). Describe the appropriate steps the nurse should take to prevent the spread of infection, including specific personal protective equipment (PPE) requirements and environmental controls. Answer: when caring for a patient with tuberculosis (TB) on airborne precautions, the nurse must take several steps to minimize the risk of transmission. Use of PPE: the nurse should wear an N respirator, mask, or a powered air purifying respirator (PAPR) designed to filter out airborne pathogens. This is crucial as TB is transmitted through respiratory droplets that can remain suspended in the air for long periods. Regular surgical masks are not sufficient. Additionally, gloves, a gown, and face protection should be worn when handling any respiratory secretions or when performing any procedures that may expose the nurse to these droplets. Hand hygiene. Hand hygiene is essential to reduce the spread of infection. The nurse should wash their hands thoroughly before and after patient contact, particularly after touching surfaces or items in the patient's room. Cleaning and disinfection. Thoroughly disinfect all surfaces in the patient's room daily, particularly high-touch areas such as doorknobs, light switches, and medical equipment. Isolation environment. The patient should be placed in a negative pressure room, which ensures that air from the room is expelled through a ventilation system, keeping the air within the room isolated from other areas of the facility. This room should be equipped with a high-efficiency particulate air HEPA filter that traps airborne microorganisms. Transport and limiting exposure. Minimize patient transport outside the room. If transport is necessary, the patient should wear a surgical mask to reduce the potential for spreading droplets. Healthcare staff should follow strict infection control practices during transport to avoid exposure. Following these practices ensures that the nurse complies with CDC's recommendations for airborne precautions and minimizes the risk of TB transmission to other patients, staff, and visitors. Describe 3 risk factors for falls in elderly patients within a healthcare facility and how a nurse can mitigate each of these risks. Answer: falls are a significant concern in healthcare facilities, particularly for elderly patients, as they are at higher risk of injury. Several risk factors contribute to falls, and understanding how to address these factors is essential in preventing them. Impaired mobility. Elderly patients often experience muscle weakness, joint instability, or limited range of motion, which makes them more prone to falls. Nurses can mitigate this risk by regularly assessing the patient's mobility and providing physical therapy or rehabilitation programs to strengthen muscles and improve balance. Assistive devices such as walkers, canes, or grab bars should be used, and staff should assist patients in moving or repositioning them when necessary. Polypharmacy and medication side effects. Many elderly patients take multiple medications, some of which may cause dizziness, sedation, or orthostatic hypotension, a sudden drop in blood pressure when standing. Nurses should monitor medication effects, especially after administering new medications, and collaborate with the healthcare provider to review and adjust the patient's medications. Non-essential medications should be discontinued when possible, and the nurse should educate the patient on how to manage their medications safely. Environmental hazards. Hazards in the healthcare setting, such as wet floors, cluttered walkways, or poor lighting, increase the risk of falls. Nurses should ensure that the patient's environment is free from obstacles and that the room is well lit. Bed and chair alarms can also be used to alert staff when a patient attempts to get out of bed, particularly if they are at high risk of falling. By identifying these risk factors and implementing appropriate interventions, nurses can reduce the likelihood of falls and improve patient safety. MS Hernandez, an elderly patient with impaired kidney function, has been prescribed a high-risk medication that is primarily excreted by the kidneys. After her initial dose MS, Hernandez shows signs of toxicity. What immediate steps should the nurse take, and what considerations should inform future medication administration for this patient? Answer: in the scenario involving MS Hernandez, the nurse must act quickly to address the potential toxicity and ensure the safety of the patient. Immediate steps: assess vital signs and labs. The first step is to assess MS Hernandez's vital signs, particularly her blood pressure, heart rate, and respiratory status, which may be affected by medication toxicity. Simultaneously, the nurse should notify the physician to request blood tests such as serum drug levels and renal function tests, BUN, creatinine, to assess the extent of the toxicity. Stop the medication. The nurse should withhold any further doses of the medication immediately to prevent further accumulation in the bloodstream. Provide supportive care. Depending on the severity of the toxicity, supportive care measures may be needed, such as administering activated charcoal if the medication was recently ingested, or ensuring adequate hydration to facilitate renal excretion of the drug. Considerations for future medication administration: renal dose adjustment. Since MS Hernandez has impaired kidney function, the nurse should advocate for adjusting the medication dosage based on her renal function. This is crucial as many drugs are excreted by the kidneys and reduced renal function can lead to accumulation and toxicity. Frequent monitoring. Future administration of the medication should be accompanied by frequent monitoring of kidney function, especially after initial doses. Dosing intervals may need to be extended or alternative medications may need to be considered. Collaboration with the healthcare team. The nurse should collaborate with the prescribing physician and pharmacist to review the appropriateness of the medication for MS Hernandez's condition and consider alternative therapies that are safer for patients with renal impairment. This approach ensures that medication safety is maintained, reducing the risk of adverse events and ensuring the patient receives appropriate treatment for their condition. During a hospital fire drill, describe the sequence of actions a nurse should take using the RACE acronym and explain the rationale behind each step. Answer: the RACE acronym is a standardized emergency response protocol that nurses should follow during a fire in a healthcare facility. The sequence of actions is as follows. Rescue. The first action is to remove any patients or individuals from immediate danger, especially those who are in areas directly affected by the fire. This is a critical step as fire can spread quickly, and ensuring the safety of vulnerable patients, such as those with limited mobility or who are intubated, is essential. Alarm. Once the patients are safe, the nurse should activate the fire alarm system. This step is vital to alert the entire healthcare team, including emergency responders, to the presence of the fire. The alarm will ensure that the necessary emergency protocols are initiated across the facility. C. Confine. After raising the alarm, the nurse should close doors and windows in the affected area. This helps to contain the fire by reducing airflow, which can cause the fire to spread. Additionally, closing doors helps contain smoke and heat, preventing it from traveling to other areas and ensuring patient safety. Extinguish, evacuate. If the fire is small and manageable, the nurse can attempt to extinguish it using a fire extinguisher. If the fire is too large or dangerous, the nurse should proceed with evacuation procedures, ensuring that patients and staff are moved to safe areas according to the fire evacuation plan. By following the RACE protocol, the nurse ensures a quick, organized, and effective response to a fire emergency, which is crucial in protecting patients and staff. A nurse is assisting with a procedure involving exposure to bodily fluids. What specific PPE should be worn, and what protocols ensure proper PPE use and disposal? Answer: personal protective equipment (PPE) is essential to protect healthcare workers from exposure to bodily fluids and prevent the spread of infections. The specific PPE that should be worn during a procedure involving bodily fluids includes gloves. Gloves should be worn to protect hands from coming into contact with bodily fluids. If the procedure involves direct contact with bodily fluids, such as blood or urine, double gloves may be required. Gown. A disposable gown or a non-sterile fluid-resistant gown should be worn to protect the nurse's clothing and skin from potential contamination. Face protection, face shield or goggles. A face shield or goggles should be used to protect the eyes, nose, and mouth from splashes of bodily fluids. If the procedure involves a higher risk of splashing or aerosolized particles, a face shield is preferred. Mask. If there is a risk of respiratory droplets being generated, for example, during procedures that may produce aerosolized particles, a surgical mask or an respirator for airborne precautions should be worn. Protocols for proper use and disposal. Proper use. PPE should be donned before entering the patient's room or before starting the procedure. The nurse must ensure that PPE is worn correctly, with masks covering the nose and mouth, gloves fitting snugly, and gowns properly secured. Removal and disposal. PPE should be removed carefully to avoid contamination. Gloves should be removed first, followed by the gown, face protection, and mask. The nurse should perform hand hygiene immediately after removing PPE, then dispose of the used equipment in appropriate biohazard waste containers. It is essential to follow institutional protocols and ensure all PPE is disposed of safely to prevent contamination. Following these guidelines ensures the nurse is protected while minimizing the risk of infection transmission. What non-pharmacological interventions can be used to manage pain in patients with chronic conditions, and how do they work to alleviate discomfort? Answer: non-pharmacological interventions are crucial in managing chronic pain, as they can reduce reliance on medications and improve overall quality of life. Some common interventions include cognitive behavioral therapy (CBT). CBT helps patients recognize and change negative thought patterns related to pain. By teaching coping strategies and stress management techniques, it can reduce the emotional distress that often accompanies chronic pain. Physical therapy and exercise. Physical therapy helps patients improve mobility, strength, and flexibility. Targeted exercises can alleviate pain by improving muscle function and reducing stiffness in joints or muscles. Movement can also stimulate the release of endorphins, the body's natural painkillers. Acupuncture. Acupuncture involves inserting thin needles into specific points on the body. It is believed to work by stimulating the nervous system to release endorphins and other chemicals that can reduce pain and promote healing. Massage therapy. Therapeutic massage helps relax muscles, improve blood circulation, and reduce tension. It can be particularly effective for musculoskeletal pain by promoting muscle relaxation and enhancing blood flow to affected areas. Heat and cold therapy. Heat therapy helps relax and soothe stiff muscles and joints, while cold therapy reduces inflammation and numbs acute pain. Both treatments are simple yet effective ways to manage pain at home. These interventions work by addressing both the physical and psychological components of chronic pain, improving patient comfort and enhancing their ability to manage their condition. Identify key strategies a nurse can implement to prevent pressure ulcers in bedridden patients, particularly focusing on repositioning, nutrition, and skin care. Answer: preventing pressure ulcers, also known as bed sores, in bedridden patients is critical for maintaining skin integrity and overall health. Key strategies include repositioning. The nurse should ensure that the patient is repositioned at least every 2 hours or more frequently if needed to relieve pressure on vulnerable areas such as the heels, sacrum, and elbows. Proper positioning techniques should be used to avoid direct pressure on bony prominences, and pillows or wedges can be used to support the body in a way that prevents pressure buildup. Nutrition. Adequate nutrition is essential for skin health and wound healing. The nurse should assess the patient's nutritional status and collaborate with a dietitian to ensure they receive sufficient protein, vitamins such as vitamin C, and minerals such as zinc to promote skin integrity. Adequate hydration is also important to maintain skin moisture and elasticity. Skincare. The nurse should keep the patient's skin clean and dry using gentle cleansers that do not irritate the skin. Moisturizing lotions can be applied to prevent dryness, especially for patients with incontinence. The barrier cream should be applied to areas prone to moisture exposure to protect the skin from breakdown. How should a nurse communicate with a patient who has limited English proficiency to ensure they understand their care plan? Answer: effective communication with patients who have limited English proficiency is essential for ensuring that they understand their care plan and feel comfortable with their treatment. Nurses can employ several strategies to enhance communication. Use of professional interpreters. Nurses should utilize professional medical interpreters either in person or via telephone or video services to facilitate clear communication. This ensures that medical terms and instructions are accurately translated and understood. Simplify language. The nurse should avoid using medical jargon and instead use simple, clear language when explaining the care plan. Visual aids, such as pictures or diagrams, can also help the patient understand instructions more effectively. Teach back method. To confirm understanding, the nurse should ask the patient to repeat the information or demonstrate their understanding of the care plan. This method, known as teach back, ensures that the patient comprehends the instructions and allows the nurse to clarify any misunderstandings. Cultural sensitivity. Nurses should be aware of cultural differences that may affect the patient's perceptions of healthcare, communication styles, and preferences. Being respectful and open to the patient's cultural needs fosters trust and encourages better understanding. A nurse is caring for a patient who wishes to discontinue treatment despite the recommendations of the healthcare team. How should the nurse approach this ethical dilemma? Answer: in situations where a patient wishes to discontinue treatment against medical advice, the nurse must navigate the ethical principles of autonomy, beneficence, and non-maleficence. Respect for autonomy. The nurse should respect the patient's right to make decisions about their own care, even if those decisions go against medical advice. It is important to provide the patient with all relevant information about the consequences of discontinuing treatment and to ensure they fully understand the implications of their decision. Open communication. The nurse should engage in open and empathetic communication with the patient, exploring the reasons for their desire to discontinue treatment. Addressing concerns and fears may help the patient feel more supported in their decision-making process. Consultation with the healthcare team. The nurse should consult with the healthcare team, including the physician, to ensure that the patient's decision is informed and that all appropriate options have been explored. Documentation. The nurse should document the patient's decision, the information provided, and the discussions that took place. How should a nurse manage symptoms in a terminally ill patient to ensure comfort at the end of life? Answer: managing symptoms in a terminally ill patient involves a holistic approach that prioritizes comfort and dignity during the final stages of life. Key strategies include pain management. The nurse should assess the patient's pain level regularly and administer analgesics as prescribed, typically using opioids for severe pain. Adjustments in dosage may be necessary to manage breakthrough pain while minimizing side effects. Symptom control. Other symptoms, such as nausea, vomiting, shortness of breath, and agitation, should be addressed with appropriate pharmacologic and non-pharmacologic interventions. Antiemetics, corticosteroids, and sedatives may be used to alleviate discomfort. Psychosocial support. Emotional and psychological support is vital in end-of-life care. Nurses should provide compassionate listening and encourage family involvement. Referral to a chaplain or social worker may be beneficial for addressing spiritual concerns or providing grief support. Respect for the patient's wishes. The nurse should ensure that the patient's and family's wishes regarding end-of-life care are respected, whether through advance directives, living wills, or discussions about resuscitation preferences. Do not resuscitate orders. Which of the following is a key nursing intervention to prevent catheter-related bloodstream infections (ESIS) when managing a central venous catheter? Answer: to prevent CIBCS, the nurse must follow strict infection control measures such as hand hygiene, proper hand washing before and after any contact with the central line, aseptic technique, ensuring sterile technique during dressing changes, blood draws, and medication administration, dressing changes, changing the dressing according to hospital protocol, usually every 7 days or when it becomes wet or soiled, catheter flushing, flushing the catheter with normal saline or heparin as per institutional protocol to prevent clot formation and ensure patency, observation for infection, monitoring the catheter insertion site for signs of redness, swelling, or drainage which may indicate infection. Relevant guidelines. The CDC's guideline for the prevention of intravascular catheter-related infections outlines these preventive measures. The use of chlorhexidine for skin antisepsis and avoidance of routine catheter replacement can significantly reduce CRBSI risks. Mr. Davis is a 78-year-old patient who has been diagnosed with Alzheimer's disease. He is exhibiting increasing forgetfulness, confusion, and wandering behaviors. The patient's family is concerned about his safety at home and is considering placing him in a long-term care facility. What should the nurse include in the plan of care for Mr. Davis to address these concerns? Answer: in Mr. Davis' case, the nurse should prioritize safety and quality of life by implementing the following: environment modification. Recommend removing potential hazards in the home to minimize injury risk. This could include securing rugs, ensuring proper lighting, and removing sharp objects. Wandering prevention. Set up an alarm system or GPS device to help track the patient if wandering occurs. Consider using a wandering mapper to identify safe areas for him to explore. Family education. Provide information on Alzheimer's disease, including common symptoms and ways to cope with behavioral changes. Educate the family about setting a consistent routine, using simple communication and offering reassurance. Advanced directives and decision-making. Discuss the importance of setting up advanced directives, such as a living will and durable power of attorney for healthcare decisions. Referrals. The nurse can refer the family to community resources such as Alzheimer's support groups or home health services that provide daily care assistance. A 55-year-old patient is prescribed a drug that undergoes extensive first-pass metabolism in the liver. How will this pharmacokinetic process affect the drug's bioavailability? Answer: first-pass metabolism occurs when a drug is absorbed from the gastrointestinal tract and is then transported via the portal circulation to the liver, where it is metabolized before reaching systemic circulation. This process reduces the bioavailability of the drug. Bioavailability refers to the fraction of the administered dose that reaches the bloodstream in an active form. Drugs with extensive first-pass metabolism will have lower bioavailability because a significant portion of the drug is metabolized in the liver before it reaches systemic circulation. Example: for a drug that undergoes extensive first-pass metabolism, such as morphine, the oral bioavailability may be as low as 25%. This is why higher oral doses are typically required compared to the intravenous route. What should the nurse do when administering an anticoagulant like warfarin to a patient at high risk for bleeding? Answer: when administering warfarin, a high-risk anticoagulant, the nurse must monitor INR. The nurse should regularly monitor the patient's international normalized ratio INR to ensure it is within the therapeutic range, typically 2-3 for most indications. This helps to prevent both under anticoagulation and over anticoagulation. Assess for signs of bleeding. Watch for any signs of bleeding, such as bruising, hematuria, or nosebleeds. If any of these occur, immediate action should be taken to reduce the risk of significant hemorrhage. Education. Educate the patient on the importance of avoiding activities that could cause injury and advise them to notify healthcare providers if they experience any bleeding or unusual symptoms. Drug interactions. The nurse should be aware of any potential drug interactions that may increase the risk of bleeding, e.g. aspirin, NSAIDs, or reduce the effectiveness of warfarin, e.g. rifampin. Dietary considerations. Advise the patient to maintain a consistent intake of foods rich in vitamin K, as this can affect the anticoagulant effect of warfarin. A patient is receiving chemotherapy for breast cancer and reports feeling nauseated and fatigued. What should the nurse consider regarding the potential side effects of chemotherapy drugs? Answer: chemotherapy drugs have a range of common side effects, and the nurse should consider the following. Nausea and vomiting. These are common side effects of chemotherapy. The nurse should assess the severity of nausea and administer antiemetics as ordered to manage these symptoms. Fatigue. Chemotherapy can cause fatigue due to bone marrow suppression, which leads to anemia and decreased red blood cell production. The nurse should encourage rest and monitor for signs of anemia. Bone marrow suppression. This is a major side effect of many chemotherapy agents, which can lead to neutropenia, thrombocytopenia, and anemia. Regular blood tests should be performed to monitor these levels. Infection risk. The patient's immune system may be compromised, increasing the risk of infection. The nurse should monitor for signs of infection, such as fever, and use appropriate infection control measures. Other effects. Depending on the chemotherapy drug, other side effects may include alopecia, mouth sores, and gastrointestinal disturbances. A nurse is educating a 70-year-old patient with osteoarthritis on managing their condition. What are the key non-pharmacologic strategies that should be included in the teaching? Answer: non-pharmacologic strategies for managing osteoarthritis include physical activity. Encourage the patient to engage in low-impact exercises such as swimming or walking to improve joint mobility and reduce stiffness. Weight management. Maintaining a healthy weight can reduce stress on weight-bearing joints and alleviate pain. Heat and cold therapy. Using hot packs or cold compressors can help relieve pain and inflammation in affected joints. Assistive devices. Recommend the use of assistive devices such as canes or knee braces to improve mobility and reduce the risk of falls. Joint protection techniques. Teach the patient to avoid overusing joints and recommend using ergonomic techniques during daily activities to reduce strain on the joints. Relevant guidelines. The American College of Rheumatology provides evidence-based recommendations for managing osteoarthritis, emphasizing a combination of physical activity, weight management, and the use of assistive devices. A nurse is caring for a terminally ill patient who has a do not resuscitate DNR order. The patient goes into cardiac arrest while the family is present. What should the nurse do in this situation? Answer: the nurse should follow the patient's DNR order, which legally prohibits resuscitation efforts. In this situation, the following steps should be taken. Reassure the family. The nurse should explain the DNR order to the family and reassure them that the patient's wishes are being honored. Provide comfort measures. Focus on providing comfort measures such as administering pain relief oxygen and other palliative interventions to ensure the patient's dignity in the dying process. Document. The nurse should document the events and the patient's status, ensuring the DNR order is clearly noted and followed. Relevant guidelines. The American Nurses Association Honor Code of Ethics emphasizes respecting patient autonomy, including the honoring of advanced directives such as DNR orders. What is a common change in the cardiovascular system associated with aging, and how should the nurse address this in the plan of care for an elderly patient? Answer: a common age-related change in the cardiovascular system is the thickening of the heart walls and the decrease in the elasticity of the blood vessels, which can lead to increased systolic blood pressure, isolated systolic hypertension. The nurse should monitor blood pressure, regular monitoring of blood pressure to identify hypertension and initiate appropriate interventions. Promote physical activity. Encourage the patient to engage in regular physical activity, which can help maintain vascular health and reduce blood pressure. Dietary recommendations. Advise a low-sodium diet to manage blood pressure and promote cardiovascular health. Relevant guidelines. The American Heart Association provides guidelines for managing hypertension, including lifestyle changes and pharmacological interventions for elderly patients. A nurse is preparing to administer medication to a patient and notices that the medication vial is labeled with a concentration that is different from what was ordered. What is the nurse's course of action? Answer: in this situation, the nurse must Double-check the order, confirm the medication order including the dosage and concentration with the physician or pharmacist, verify the medication and concentration, ensure that the medication vial corresponds to the ordered drug considering its concentration, calculate the correct dose. If necessary, calculate the correct volume of the medication to be administered based on the concentration in the vial. Clarify before administration. If there is any uncertainty, the nurse must not administer the medication until clarification is obtained to prevent medication errors. Relevant guidelines. The Institute for Safe Medication Practices provides guidelines for preventing medication errors, including verifying orders and drug concentrations before administration. A patient recovering from abdominal surgery reports severe pain that is not adequately managed by the current opioid prescription. What is the nurse's best course of action? Answer: the nurse's best course of action is to assess the pain thoroughly using a pain scale and consider other factors that might be affecting pain control. The nurse should reassess the pain, evaluate the intensity, location, and quality of the pain, and check for any signs of complications such as infection or a blocked bowel. Non-pharmacological interventions. Introduce non-pharmacological methods such as relaxation techniques, deep breathing, or distraction to complement the pharmacologic treatment. Consult with the healthcare provider. If the patient's pain is still inadequately controlled, the nurse should consult with the healthcare provider to adjust the opioid dosage, add adjunct therapies, e.g. NSAIDs, gabapentinoids, or explore alternative pain management methods. Monitor for side effects. Ensure the patient is not experiencing any opioid-related side effects, such as respiratory depression or constipation. Relevant guidelines. The American Pain Society recommends a multimodal approach to pain management, considering both pharmacological and non-pharmacological interventions. If a nurse manager, you are overseeing a team of nurses in a busy unit. You are preparing to delegate tasks to your nursing team. What are the primary considerations you must take into account when delegating tasks to a licensed practical nurse, LPN, and how does the scope of practice impact your delegation decisions? Answer: when delegating tasks to an LPN, the nurse manager must consider the scope of practice defined by state regulations and the specific skills and competencies of the LPN. According to the Nurse Practice Act, in many states, LPNs can perform routine procedures such as administering medications and monitoring patient status, but cannot engage in complex assessments or provide education at the same level as registered nurse or RNs. Key considerations include scope of practice, ensure that the task aligns with the LPN's education and state licensing requirements. Skill level, evaluate the individual LPN's ability to perform the task safely and competently. Supervision needs. Tasks requiring assessment or critical thinking should remain within the RN's scope, while routine care can be delegated to LPNs. The National Council of State Boards of Nursing (SEN) provides guidelines for delegation that help clarify the types of tasks that can be delegated based on the nursing role and patient complexity. A 72-year-old patient is scheduled for surgery to repair a hip fracture. The surgeon explains the procedure to the patient, but the patient is confused due to their cognitive decline. How should the nurse proceed to ensure the patient's rights are upheld, and what are the nurse's responsibilities regarding informed consent in this scenario? Answer: informed consent is a legal and ethical requirement in which a patient must understand the nature of the procedure, its risks and benefits, and must voluntarily agree to undergo the treatment. In this case, the patient's cognitive decline may impair their ability to understand the information provided. The nurse should assess the patient's ability to understand the procedure and determine whether the patient is mentally competent to provide informed consent. Involve a surrogate decision maker. If the patient is not capable of providing informed consent, the nurse must ensure that a legal guardian, power of attorney, or another legally authorized representative gives consent. This is in accordance with HIPAA regulations and state laws governing consent. Document the process. The nurse should ensure that the entire process, including discussions with the patient and surrogate, is well documented to ensure patient rights are upheld. The NCSBN states that the nurse's role in informed consent is not to explain the procedure but to ensure the patient's understanding and the presence of the appropriate legal proxy when necessary. Mr. Thompson, a 55-year-old patient with chronic obstructive pulmonary disease (COPD), is admitted for exacerbation. The attending physician orders a multidisciplinary approach to care involving respiratory therapists, dietitians, and a social worker. As the primary nurse, how should you coordinate care among these team members, and what are your responsibilities in ensuring optimal patient outcomes? Answer: in this scenario, the nurse plays a central role in coordinating the care provided by the interdisciplinary team. The nurse should ensure clear communication, facilitate regular communication among all team members. This includes sharing patient progress, any changes in condition, and the specific needs of the patient. The nurse must act as a liaison between the patient and the team, assess and address holistic needs, conduct ongoing assessments of Mr. Thompson's physical, emotional, and social needs. For example, if his COPD exacerbation is causing difficulty with eating, the dietitian can provide input on nutritional management, while the social worker can assess for any home care needs. Patient education and advocacy. The nurse must ensure that the patient is educated on self-care techniques for managing COPD and advocate for any necessary resources or support systems, e.g. home oxygen therapy, smoking cessation programs, to improve the patient's long-term outcomes. The NCSBN emphasizes the nurse's role in coordinating care, ensuring that all team members work collaboratively to create a comprehensive care plan that addresses all aspects of the patient's condition. During your routine safety rounds, you observe that several medication errors have occurred due to similar patient identifiers being used in the hospital. What steps should you take to address this issue, and what framework should you use to implement a quality improvement process? Answer: to address the medication errors related to patient identifiers, the nurse should report and document the issue. The nurse must document the observed safety issue and immediately report it to the nurse manager or quality improvement (CHI) committee. Accurate documentation helps track incidents for analysis. Root cause analysis. The root cause analysis, a CA, should be conducted to identify the underlying cause of the medication errors. In this case, it may involve reviewing hospital protocols for patient identification and medication administration. Implement changes using the Planned Use Study Act (PDSA) cycle. This QI framework allows the nurse and hospital team to systematically implement changes such as improving the patient identification process, e.g. using 2 identifiers instead of 1, and evaluating the impact of the change on patient safety. The Institute for Healthcare Improvement (IHI) provides guidelines on using the PDSA cycle to enhance safety practices. A 65-year-old terminally ill patient, Mrs. Carter, expresses the desire to stop all treatment and enter hospice care. The family disagrees and insists that the patient continue aggressive treatment, believing it might extend her life. As the nurse, what should you do to advocate for Mrs. Carter's wishes while considering the ethical principles of autonomy and beneficence? Answer: in this case, the nurse must prioritize the ethical principle of autonomy, which upholds the patient's right to make decisions about her own care, even if those decisions conflict with family wishes. The nurse should respect Mrs. Carter's wishes, discuss Mrs. Carter's wishes in private, and ensure she fully understands the consequences of stopping treatment. Document her decision and communicate it clearly to the healthcare team. Facilitate family communication. Act as a mediator between the patient and her family, providing information on the benefits and potential burdens of continued treatment versus hospice care. Consult ethics committee. If the conflict persists, the nurse may recommend involving the hospital's ethics committee to facilitate a resolution. According to the American Nurses Association on a Code of Ethics, nurses are ethically obligated to respect the patient's wishes and act as patient advocates even in the face of family opposition. How does hypertension contribute to heart failure, and what physiological changes occur in the cardiovascular system as a result of long-term uncontrolled high blood pressure? Answer: hypertension is a significant risk factor for the development of heart failure due to its chronic effects on the heart. Over time, high blood pressure causes increased afterload or resistance against which the heart must pump. The physiological changes include left ventricular hypertrophy. Chronic high blood pressure causes the left ventricle to work harder, leading to thickening of the ventricular walls. This reduces the heart's ability to fill properly, decreasing stroke volume. Heart failure with reduced ejection fraction, HREF. Eventually, the heart's ability to contract weakens and the ejection fraction decreases, leading to systolic heart failure, fluid retention, and pulmonary edema. With reduced cardiac output, the kidneys respond by retaining sodium and water, leading to fluid accumulation in the lungs and peripheral edema. According to the American College of Cardiology Act, management of hypertension is crucial in preventing progression to heart failure. What steps should a nurse take during discharge planning for a patient with multiple chronic conditions to ensure continuity of care post-discharge, and how do community resources play a role in this process? Answer: discharge planning is a critical component of ensuring that patients with chronic conditions receive proper care after leaving the hospital. The nurse should assess patient needs, identify the patient's medical, social, and emotional needs upon discharge. This includes medications, follow-up appointments, and home care requirements, coordinate with providers, Ensure that referrals to specialists, home health care services, and community resources, e.g., social workers, rehabilitation services, are made. Educate the patient and family. Provide detailed education on disease management, medication adherence, and recognizing warning signs of complications. Community resources such as home care services, transportation assistance, and support groups can help patients manage their conditions outside the hospital. The National Association for Home Care and Hospice (NOC) offers guidelines on post-discharge care coordination. How does a myocardial infarction affect the electrical conduction system of the heart, and what are the typical ECG changes observed during an MI? Answer: a myocardial infarction disrupts the heart's electrical conduction system due to ischemia and cell death in the myocardium. The typical ECG changes observed during an MI include segment elevation. This is indicative of stent elevation myocardial infarction (STEMI) caused by complete occlusion of a coronary artery. T-wave inversion occurs in non-elevation myocardial infarction (NSTEMI) or in the later stages of STE, MI as ischemia persists. Pathological Q waves. These develop as the infarcted tissue loses its ability to conduct electrical impulses. American Heart Association (AHA) guidelines emphasize the importance of early ECG monitoring and intervention to minimize heart damage. What are the hallmark signs and symptoms of Parkinson's disease, and how do these symptoms result from the underlying pathophysiology of the disorder? Answer: Parkinson's disease is a neurodegenerative disorder primarily affecting the dopamine-producing neurons in the basal ganglia, leading to motor dysfunction. The hallmark symptoms include bradykinesia, slowness of movement. This occurs because of the loss of dopamine, which is essential for initiating and controlling voluntary movements. Resting tremor, caused by the dysfunction at the basal ganglia, leading to involuntary shaking when the muscles are at rest. Rigidity, muscle stiffness occurs as a result of an imbalance between dopamine and acetylcholine in the central nervous system. The Parkinson's Foundation provides evidence-based strategies for managing these symptoms, including medication, e.g. levodopa, and physical therapy. A nurse overhears a colleague discussing a patient's diagnosis and treatment plan in a public area of the hospital. What should the nurse do in this situation, and how does HIPAA apply to this scenario? Answer: HIPAA, Health Insurance Portability and Accountability Act, mandates strict confidentiality regarding patient information. In this situation, the nurse should intervene immediately, politely inform the colleague that discussing patient information in a public area violates patient confidentiality and HIPAA regulations. Report the incident. If the conversation continues, the nurse should report the incident to the hospital's privacy officer or supervisor to prevent further breaches. Educate and prevent. The nurse should educate colleagues on the importance of safeguarding patient information and the risks of violations. Violations of HIPAA can lead to legal consequences, including fines and loss of licensure. The Office for Civil Rights (OSAR) provides enforcement and guidelines for handling patient information appropriately.